Hi there again. Welcome back to the Seattle Convention Center here in downtown Seattle, in for the 27th Annual Alzheimer's Association Regional Conference. And we've had an opportunity to chat with so many folks here today and already seen some great presentations, one of which was given by the keynote speaker today who's with us right now. Very privileged to have Dr. Gary Semel in for some time. Dr. Semel is with the Division of Geriatric Psychiatry with the University of California at Los Angeles, also with their Longevity Center there, and is also a part of the Semel Institute for Neuroscience and Human Behavior. And I know that you've probably got a litany of other things as well, Dr. Semel, that are in your dossier, but we appreciate so much your time to take with us today and share your expertise. Seattle is a place you get to how often along the route?
I was just here a few months ago, so it seems more and more I'm coming to Seattle, and I love it here. People are fantastic. Weather is interesting, but it contrasts well with Los Angeles.
I know it's kind of a big question for us to jump into right away, but I'm curious, since we're talking geography, that was part of minimally what was discussed today in your keynote address, talking about other parts of the world where maybe Alzheimer's is not as big of an impactor as we see in the United States. I'm wondering if there are places in the United States where maybe even we're seeing better returns as far as the numbers statistically about survival rates and about people not contracting Alzheimer's.
We certainly see differences in survival rates within the United States based on geography. And what we think is a big reason for this is lifestyle. So I was emphasizing how healthy behavior can protect your brain. Healthy behavior also can help you live longer. So we know that when people overeat, when they smoke too much, they don't take their blood pressure medicine, they're not going to live as long, and they're going to have a higher risk for Alzheimer's.
So we were only left to guess, and again, we don't mean to stigmatize cities like Las Vegas, Memphis, New Orleans, maybe places where, again, diet has already been brought out as a problem as far as health is concerned, just because of what's available for people, what their lifestyles are. Is that the kind of thing we're talking about, really? Or?
Well, not only different cities varying, but also rural versus urban areas. And surprisingly, in general, urban areas do better. People think, oh, but all the smog and all the traffic, isn't that stressful? Isn't that bad for us? Well, you have the other side of it, and that is there's a lot of social interaction. There's a lot of good health care that's available. There's people who can help you out. There's maybe more education. So in general, there is a slight advantage in being in a city than being in the country.
Wow, okay, so that's something that you probably did not realize that we can take heart in. If we live in a city, if we're in a more rural area, I guess it's up to us to do a little bit better. Dr. Semel, I'd like to go back in time here. I found it very compelling what you talked about as far as the very first case of Alzheimer's that was identified back in 1906, and then really a huge gap in between focusing on that disease all the way up until the late 60s. It didn't seem like you said the research really started to ramp up. Why was that, first of all, and have we seen another one of those gaps since then at all?
Well, I think the big reason was that we didn't recognize that Alzheimer's disease is not just a rare presenile dementia affecting people in their 50s. It wasn't until the pathologists did the studies, found the same plaques and tangles that Professor Alzheimer described in 1906 in the brains of people with senility. We thought senility was just a normal part of aging, not a disease. So that was very important to really get the field started. Now, since then, the research has continued to ramp up. The interest is continuing to ramp up. And we have more and more initiatives. We have more money being invested. We need a lot more. We have a lot of bright minds focusing on it. We still need more of them. So I think we have to continue our efforts. We have to continue working hard. And I'm confident if we do that, we're going to see some breakthroughs.
And I know that you've talked about today in your keynote address, and we've heard, and you may have done some research on your own, perhaps even by now, that genetics do play a part in this. About a third of the folks that are out there are somehow more predisposed to potentially having Alzheimer's at some point along their lives?
Well, it's actually, I wouldn't look at it that way. I think in the average person, that what determines their risk is about a third genetics. So the idea is that you do have some non-genetic factors and some lifestyle behaviors that are more important than you may realize.
Okay, and those lifestyle behaviors we definitely want to chat about, because it seems like prevention is the hull of all of this right now until there is a cure. And I don't know, I hate to even say should we root for a cure, because it seems like when we do that, Dr. Semel, you even mentioned you have patients that say I'd really rather just take a pill. It cuts off our ability to to really prevent a lot of things that could go wrong with our health in the future. But talk to us about the difference, cure versus prevention. Is that something that you think people are going to be able to recognize and get throughout the course of time?
Well, I think there's a lot of controversy about what we mean by prevention. I tend to look at it as possibly delaying the onset of symptoms. So not necessarily preventing it for your entire life, although if you delay the symptoms long enough and you die of natural causes, that could be the case. So I think a lot of people equate prevention with cure. I think, to me, it's really a semantic argument. What we're really talking about is trying to protect a healthy brain rather than trying to repair the brain once a damage sets in. And I think prevention strategies are probably more feasible in our lifetime than an actual cure. We may discover an actual cure with new bioscience technologies, but I think we're on the road to developing preventive treatments and strategies right now, and there are things we can do right now that look like they keep our brains healthier longer.
Okay, and I know that working out your brain is something that you can do. You talked about different ways that folks can do that, but really there needs to be, it sounds like, a literal connection that is broached, I guess, in a person between their mind and their body, because there tends to be a separation there, but a healthy brain is part of a healthy body, and I know that was a big part of your message today. How do we get folks more aware of the brain as an organ, much like a heart, or, it seems like we can focus on other parts of the body a lot more than we can the brain for some reason. How do we get over that?
Well, I think that we're getting more interested in it. We have 80 million baby boomers who are now starting to turn age 65. They're noticing their memory changes. They're more interested in understanding it. We need to first educate people on the connection. During the discussion, somebody came up to me and said, well, I would never watch my diet or exercise, but I got a blood test for my blood sugar and it was a little bit high. And that hit me. Gee, I know what diabetes is. I got to do something about it. So sometimes feedback, understanding the connection, will start people to get motivated. And so what we'd like to do is develop programs that make it easy. People see results right away, and that motivates them to continue for the lifetime, because they've got to get brain healthy behaviors translated into brain healthy habits. It's got to be the long term.
Very good, and it's a good thing for us to start thinking about, I would imagine, as early as we can in life. Obviously, younger people don't start focusing on these things until the aches and pains set in, but we are hearing of some unfortunately rare, but still some unfortunate cases of early onset Alzheimer's as well, and those are becoming more common, unfortunately. Dr. Semel, I'm curious to know, from the perspective of maybe watching a parent, watching a loved one who maybe is in that zone for potentially having early onset dementia or potentially Alzheimer's, which would be the bigger concern there. What do we need to look for? What are some of the things? Because people might jump the gun and might be alarmed by something that is very minor, but they also may be overlooking something that's a very major problem. What should we look for?
It's challenging because we know that our memory gets worse as we age, and it's a normal part of aging. The question is, when is it really a problem? And I think if you're worried about it, that might be a time to ask the doctor, because there's so much denial. There's so many people who are just sloughing it off and coming in late that it really is an issue. And we know from studies that when you start treating early, you get a better outcome. So if people are concerned that this memory problem is really interfering with the person's everyday life, that may be the time to take a look at it.
All right, very good. Dr. Semel, I want to keep you a couple more things, so we do want to talk about your book certainly as well, but I'm curious to know, we heard a lot of interesting information about caffeine, about wine. Someone mentioned coconut oil. It seems like maybe every, I'm not sure how often in your field, but every so often there is a new potential miracle that might be out there in nature in particular, or you talked about modesty as far as alcohol consumption was concerned. Couldn't hurt, but certainly isn't necessarily be a cure-all. Is there anything you've seen in your practice over the years that you might think would be almost a necessity to put in and be inclusive with some of these dietary regimens and some of these exercise routines?
Well, I think, one thing that's essential is physical exercise, because the most compelling evidence is that physical exercise will protect your brain and probably delay the onset of Alzheimer's symptoms. Beyond that, I think we're still struggling with what we need to know. But I think a theme that I do get into in our new book, the Alzheimer Prevention Program, is inflammation. That we think a lot of these age-related illnesses, like Alzheimer's, are a result of chronic low-grade inflammation in the body and the brain. When we think about inflammation, it's our body's response to an infection or a foreign body. All these cells try to tackle that intruding agent or infection. But when there's too much, and that's a good thing, when there's too much inflammation, when it's chronic, it turns out that these cells actually attack our own cells, and it's not a good thing. And much of the Alzheimer prevention strategies are anti-inflammatory strategies. Getting a good night's sleep, physical exercise, eating omega-3 fats and fish and nuts. These are anti-inflammatory strategies. So we're looking for new approaches to fighting inflammation that are safe and effective.
All right, very good. And I imagine you can find just a few of those, if not a whole bunch, in Dr. Gary Small's new book. Again, it's called the Alzheimer's Prevention Program. And is this really a program of prevention, just like it says? Is they're going to spell it right out for you?
It spells it right out. It actually gives you the new science, and in a way that's easy to understand because my wife helped me write it. And she speaks English, I speak science. And we actually provide a 7-day jumpstart program where people can try out these strategies, and we give simple tools where you can assess yourself before and after the 7 days so you can see improvement and motivate yourself to continue those strategies for the rest of your life.
Very good. Well, it's something we'd advocate that you pick up. Again, I imagine it's available at all major book retailers, Amazon, etc.
All those good places you can find books.
All right, very good. And as we learned from Dr. Small earlier today as well, it's not a bad thing to go online and do a little Google searching either. So if you want to do that, it's good for your brain. Dr. Small, one last thing I was curious to know about. You did briefly talk about your own personal involvement with Alzheimer's within your family, and I'm wondering, after having done so many years of research on this subject, after having really attacked it from a clinical perspective, if that gave you a new insight to carry forward with your work in your writings and also your speeches and just in general with your practice.
Well, of course it does. I mean, when it strikes you personally, you really understand it. I've seen in my wife and her sister how challenging it is to see their mother disappear before their own eyes. And the way I don't know my mother-in-law as long or as well as they do, so it has an impact on me, but at a different level. And so as a clinician, as a family member, it's really compelling, and it really does motivate me to want to work harder and try to tackle this devastating illness.
Well, you've certainly done a lifetime's worth of work on it for certain. Keynote speaker today here at the 27th Annual Alzheimer's Association Regional Conference in downtown Seattle. Dr. Gary Small also just recently wrote this book, Alzheimer's Prevention Program. Again, you can pick it up online. Go to the library as well. I'm sure they'd have a copy too. Dr. Small, thank you so much. I know your time is very valuable. We appreciate it, and we wish you the best of luck in all of your endeavors in the future. I hope that we all are able to stem this tide at some point in the future in our lives.
Thank you. I really appreciate it.